So the stimulus to write a scientific paper comes across when we see something new, something that we haven't experienced in our practice. And then we are enthused to write maybe a case report or collate our papers into a case series or then go on to an RCT. For senior surgeons who have got a large volume of work behind them, they would want to analyze their results, especially when their work slows down during COVID times or otherwise, just to see how much effectivity their treatment modalities are having is what makes them to publish more. Make sure that outcomes need not always be great or extraordinary. Our average or above average results or outcomes are good enough for people to see. And for the younger generation, the stimulus is most often, it's a part of their career advancement, seeking fellowship opportunities abroad by writing papers. So whatever be it, once we have the intention of writing something, then comes the conception of an idea. The idea could be anything. Can I just see the outcomes of the ITs that are fixed? Can I just see the outcome of the ankles that are fixed? This is how you can start off from your residency. Once you have this idea, that's where you begin your work. Make sure that your idea is very simple and reproducible. Once that is done, the next important step is how do we read and get clarity on the topic? That comes by reading other manuscripts that are already being published, and that is the only step that gives you additional clarity. It gives you what parameters you need to study. How do we be clear and crisp in your way of thinking and putting pen to paper? It helps us avoiding assumptions. What is there in an ankle fracture, you would say? But when you read literature on that, you'll realize that even the rehab protocols post your fixation could have a great impact on your mobilization. So that's where we come in when we talk about avoiding assumptions. So amongst all the clutter that we have in our minds, scientific reading gives you clarity. And that's how you start off with. Next, most important part is whenever you have a draft prepared, so try and get your draft ready. So write your plan on paper. The details come out only when you have your pen to paper, when you write them on paper. Then you would have a logical sequence of thinking. You can sort your data well. Once you have a primary data, make a habit of presenting your study at conferences, meetings. So whenever you have a presentation in front of the audience, you have n number of people who are thinking in different ways about your topic. So it becomes like an internal peer review. You don't have to wait for 3 months, 6 months for the journal to give you a peer review. That's a quick peer review, and that really fine-tunes your way of writing. When you're writing, please make sure that you illuminate on the idea and not the flair of writing. Use simple words, simple phrases, but get to the point. The elements of a manuscript are a title, abstract, introduction, methods, results, discussion, and references. We'll see more of these discussions when the session goes on. The title is the most important part, if I were to quote, because that is an advertorial for your paper. Only after reading the title, the reader decides to read your manuscript. So make it crisp, make it concise, let it be short and catchy. Let it depict the exact objective that you want to find out. Avoid terms like study of, investigation of, which take away the interest of the reader. So if you want to talk about COVID, even the Journal of Arthroplasty has got many number of articles on COVID. So if that is something that the readers want to have interest in, you can have titles on the same. Now these are a few titles from JBJS. As you can see, one-liners, satisfaction with alignment after reduction of a displaced distal and radius fracture. So just get to the point. It has to take and catch the attention of the reader. These are a few titles from the Bone and Joint Journal. So as I said, is tranexamic acid use in patients with a hip fracture safe? So these are open-ended questions, but get to the point. Catch the attraction of the reader. That's what makes them read your paper. So the objectives that we're talking about should be specific, they should be measurable, they cannot be vague, the patient feels good after surgery, that's not acceptable, it should be a measurable outcome, they should be achievable in your setup, they should be relevant to your target audience, and it should be time-based. So when we are thinking of writing an introduction, that explains the rationale of my paper. So it has to be written in a present tense, the objectives have to be defined as I have told you. We follow the funnel approach while writing the introduction. That's when we start off with something that is known to the masses. Then we describe what are the lapses or gaps in knowledge, and then we funnel down to whatever we need to focus on that particular paper. Then we come to the methods section, where it's usually written in the past tense. It describes a logical sequence from data collection onwards. Let it be prospective, retrospective. You need to state what blinding you're using, what is the timeline of the study, what are the exact steps of your procedure, even the positioning be described in detail. Describe the follow-up protocols. Make sure that you describe the manufacturer or the make of the implant, software or device that you're using. Make sure how the data was processed, including the version of the statistical software. Be very clear about what inclusion and exclusion criteria you're following. If you describe all this in a methodology, that makes the paper as clear and reproducible as possible. So the person sitting across the globe should be able to reproduce your study by reading your methodology. I think that is the success of your manuscript. So I would like to stop here. Remember, scientific writing has to be responsible, because a few words today could represent hope and aspirations of generations to come.